Never in better hands than you are with Dr. Jennifer Jablow, and that is because she has a very prominent practice in New York City, but she is known for treating the most elite CEOs, celebrities, hosts. She's won lots of awards, and most of the time we talk whitening, but today we're gonna talk about fortifying, taking our smiles and not only protecting them, but trying to restore them from the damage that can happen over time, whether it's just aging or the things we're eating, could be any of it. We're gonna treat it right now. So I wanna welcome you to Lunch Rush. First of all, it's good to see you.
Good to see you.
I know you've got shows all day today.
Yes, we have shows, Beauty Report tonight and throughout the week, but this is the only time you're gonna see the Fortify. And this is a special duo that we're doing. There's 30 to 40 treatments in here, and what's so important about this is the first time ever with the product that I can say on air, you're actually repairing your teeth.
That's amazing. And here's the thing, I know in your practice, usually you're like, it's like $100 a tooth to do this treatment. So what you're getting today, normally one tube and the guard that you need to push the teeth back, it's a specially designed mouth guard. Normally just these two is $36.50. So you're getting that and you're also getting a second tube. So if you say 40 treatments, it's a really wonderful value at this price point. But let's talk about what is fortifying our teeth and who needs to do it.
Over time, this is for everybody. This is a prevention, and this is also for repair. Over time, acids from foods, stomach acids, just everything wears down our enamel. And if you've used those white strips, we know what that does to your teeth as well. This is a special Japanese technology that I use chairside at my office, like $100 to $200 per tooth. And you're just gonna go into like an area, maybe like up here, where you have a little discomfort when you're drinking something hot or cold, or you feel like it's weakening, and you're just gonna place a tiny little bit in one area or two areas. You're not painting every single tooth. When you take the mouth guard out, what's gonna happen is it's gonna super saturate your saliva with nanotechnology of calcium and phosphate, which is the building blocks of teeth. There is no toothpaste that can do this. This is a specific treatment that's going to help repair the enamel and literally put the building blocks back into the teeth. You're not painting every single tooth. And look at this. This is an extreme close-up that we did at a university. This is 1,000 times microscoped, okay? Wow. So the before looks like Swiss cheese. If we put any of our teeth under there, that's what our teeth are gonna look like just from daily wear. The after, do you see after one application, okay? Look at how all the minerals filled in all those spots of Swiss cheese, okay? So it's kind of like spackling the walls, but it's gonna help with discomfort, it's gonna help with the gloss and the sheen of the teeth, and it's gonna help strengthen and repair. So you're not painting every single tooth.
Yeah, that's what I wanted to say. It's a unique formula. You really do one or two, and then once you take the guard out and you go to bed, once your saliva hits that, it's like it goes to work. So you don't wanna waste all the product, first of all, but secondly, it's not how it's designed to work, right?
All you're gonna do is dial up just a little bit of product. The first time it's gonna prime, it'll probably take about 20. You're gonna get a little drop, and then you're just gonna go to work. So say this tooth has been uncomfortable, it's been bothering me, I'm just gonna go right at one tooth, take the mouth guard out before you go to bed, and then let the saliva get all over and saturate it. And what it's gonna do is put that nanotechnology to prevent cavities. This is not a toothpaste, and no toothpaste can accomplish this. Prevent cavities, repair the enamel at the microscopic surfaces, make you more comfortable when you're drinking something hot or cold or acidic. This is actually repairing the tooth from the inside out. This is a Japanese technology that's normally I charge $100 to $200 per tooth. Most dentists don't even know about this technology, and it literally rebuilds the teeth. You're only placing it in one or two spots of your mouth. You're not painting it on every single tooth, even if you feel like all your teeth are uncomfortable, because once you take out the mouth guard, you need the tiny little drop, it's gonna saturate into your saliva, and it's gonna start repairing and working while you're sleeping.
Is there anybody who shouldn't be using this, or any type of tooth that you can't?
This is for every single person. Even if you have a crown, just go up at the neck where the crown starts and put it here, because it's so small, the molecules, it'll be able to penetrate even under the crown.
And look how quick this is. I mean, she just did it in that one explanation. And just leave it be, you know?
And then go to bed. That's it.
Easy.
It's
now,
so simple.
Are we doing this every night? Is it once a week?
You can do this a couple times a week, and you're gonna start to notice that your teeth are gonna feel more comfortable when you're drinking hot or cold. And this is for somebody who maybe has gum recession, and there's certain areas, and they're scared about getting cavities there, or you grind your teeth a lot and your teeth are thinning. This is for just about everybody. So you're only placing it in one or two spots per time, maybe 2 or 3 times a week at the most. So this is gonna last you a long time, because you're getting 30 to 40 treatments in each tube. A tiny drop goes a long long way. You're not placing it on every single tooth. Take the mouthpiece out. This is the last thing before you go to bed, and it's gonna saturate your saliva while you're sleeping. It's gonna protect you while you're sleeping, and it's also gonna help rebuild the teeth from the inside out. So your teeth are gonna feel stronger and more comfortable.
I mean, imagine what this is saving you. First of all, obviously—
oh my God, the prevention.
The prevention is great. The time, the stress of having to make appointments and figure out where to go, and then what do I do? The money. I mean, if you were to go see Dr. Jablow in New York City and say you needed this treatment, you're looking at $100, $200 per tooth. This is a very special technology, but what she's done is taking that system and put it into a pen that you and I can use at home. And typically, this is what you would get. You get the pen and the mouth guard. That's a $36.50 value. That's the cost we're doing today, but you're also receiving the second pen. So, I mean, it's really nice to know whole family could use this if they needed to.
Absolutely.
You've got 2 of the pens, one for the husband, one for you. And that's it. And you know, I'm curious, will our teeth look different when we're using this?
They will actually have more luster to them, more gloss, a highly glossed finish. But this is for ages 13 to age 90, especially if you have kids that are in braces. You know how the teeth can like lose minerals while you're in braces. Your teeth can lose minerals from drinking soda, coffee, orange juice, whatever it is. This is gonna help repair whatever damage you've done from the acid actually attacking the teeth.
How nice to coat, to fill in, remineralize is the word I keep hearing you say. And then get that luster.
Putting the minerals, the calcium and the phosphate, the building blocks of the teeth. Remember, you're only placing 1 or 2 tiny drops. That's all you're doing. You're not painting every single teeth. Once you take out the mouth guard, it's gonna saturate your saliva. It's going to get to every tooth. It's gonna get inside. It's gonna get into your whole mouth, nooks and crannies, because the technology is special and it super saturates the saliva, so it'll get into all those nooks and crannies, even in between the teeth.
Listen, it may be worth giving it a shot. See what happens. This is coming from an actual practicing dentist. I think it's really important to keep that in mind. You do have 30 days to try everything out. If you're unhappy, you can send it back, but it couldn't be simpler. This is like toothbrush bristles. You twist the bottom, put it on 2 teeth, like Dr. Jablow is saying, go to bed. Great value on this as well. So I'm looking forward to seeing you on the Beauty Report tonight. That would be awesome.
This will not be on the Beauty Report. This is the only time you're seeing that today.
Okay, well, thank you so much for coming into Lunch Rush. We'll see you later. We've got some info about the list coming up this week with Colleen, and then on the other side, Lunch Rush will continue with origami and bear traps.